intact eardrum. That's all the debris that I removed from the patient's ear. You can see it's quite a significant amount of earwax. I hope you enjoyed that video. Matted, sticky earwax and dead skin, as you can see. I'm using our standard specular size, which is a size 2, which has an internal diameter of 4.25mm. So it's in keeping with the normal speculi that most audiologists use to examine the ear, for at least for adult patients. We have got a smaller size specula as well, for more narrower pediatric ears, and that's got an internal diameter of 3.5mm. And all of our speculi, there's two larger sizes, a 5mm and a 5.75mm. All of our speculi, they have a flared proximal end, so it stops you from over-inserting it into the ear. And we have an opening at the top, which assists with the insertion of the instrument. So I've managed to remove the more lateral wax and dead skin here, so we're now more halfway into the ear canal. I'm just readjusting the focus. And this wax was really impacted. I had to use an ear hook in the end to remove the final section of the wax, so you will see that. And in fact their right ear was even more blocked. So we're in the last third of the ear canal now, so again I'm just adjusting the focus. And there's two ways you can use the WAXscope. You can have the focus set to a set level, and then you can either go further in to get more focus with the deeper wax, and vice versa. If the wax is near the entrance, you can just come away with the WAXscope. So it's a fixed focus. Or you, which is what I prefer, is to fully insert the speculi to straighten and dilate the ear canal, and then just with my finger on the app I can adjust the focus if need be. We are also working on an autofocus feature where you can tap the screen and it should focus on the object that has been identified when you tap, but we'll see how that goes. And again, you can adjust the exposures if you want more brightness, again, or with a single swipe of the finger on the app. I don't really feel the need to do that much with the WAXscope, truth be told. So once you've got the exposure set, it shouldn't really need to be adjusted. So this is the more medial wax. This is the bit that's really impacted against the patient's eardrum. It's lodged beyond the isthmus, so the isthmus is a narrowing. There's two isthmuses within the ear actually. There's one in between the first and second bend of the ear canal. That's the narrowest portion of the ear. So that's the outer lateral third, and then you've got an isthmus narrowing about 0.5 centimetre away from the eardrum. So the ear canal narrows and it widens. And this wax has been pushed beyond that narrowing, so it's lodged in the wider section. So we have to retrieve this, pull this through. Of course, because the wax plug is larger than the isthmus of the ear canal, it's trapped there. So we have to really leverage this forward. So I'm just doing it slightly forwards. This wax plug, you can see it's almost like a bird's nest, and it's got a lot of hair in there. And I think at this stage, I brought it just to the second bend. On the left hand side, you'll see a bit of cartilage, a bit of flesh. That's the second bend, so probably a centimetre away from the entrance of the ear. And it's not going to come any further than that. So in a moment, I'm pretty sure I'm going to use the hook. And this is one of the advantages of the WAXscope. You're not just limited to microsuction, you can use all instruments. In fact, we've developed, or are in the process of developing our own range of instruments, which it's not only more efficient and easier to use with the WAXscope, but even if you're performing earwax removal using different visualization techniques, what we've developed hopefully is going to help you regardless of which visualization method you're using, whether it's an ENT microscope, head loops, the WAXscope, or the endoscope. So that should be launched in the next couple of months. So I managed to extract that using the ear hook, and just now visualizing the eardrum, just getting it in focus. You can see there's a bit of tympanoid sclerosis anteriorly. There's just a bit of a thinning of the eardrum there, so I've just zoomed in just to make sure there's no perforation. Again, just adjusting the focus just to get a really good vision here. You can see all the blood vessels, capillaries around the hammer bone. Again, I'm just going back in again. I think I'm going to zoom in as well. So that's one of the additional features we're developing with our own app. There's a zoom feature there, as you can see. I'm going to use it in this right here, the zoom, to remove some more deep wax, so do stay tuned for that. So again, I'm just dilating the ear canal. I have, as I said, we have got 4 sizes. I think for me, I'm probably going to be using more often than not the 4.25 is what I'm using here. This is going to be my go-to. And then if there's a narrower ear, I'll revert to 3.5. The 5 and the 5.75, they're more for more larger ear canals. I probably won't see them as often. Because most people with ear wax do have narrow, twisty ear canals. That's one of the causes. Or if you've got some of the mastoid cavity, so 5.75 would be great for that. But we've got all the options there. When I first started developing the speculi, did a bit of market research, because I used to perform ear wax removal before using endoscope, using a speculi. I used to use a microscope or head loops. But I just wanted to get some feedback of the people who do it day in, day out in terms of the most common speculi size they're using. The answer we got back was 5mm, but the more I've been performing the procedure with the speculi, I actually prefer a smaller size. And it doesn't really impact on the view. So again, I've just zoomed in here at the roof of the ear canal. So I'm inserting the hook there. But the hook just dissected through the wax plug, it didn't retrieve it. So I just put some olive oil spray in there just to change the consistency. Gonna get it in focus, as you can see. And then it's just helped loosen this wax a bit. Ironically, although the right side probably took a bit longer to remove than the left, but the patient felt the left ear was the worst of the two in terms of their symptoms. And you can just see the magnification we can get with the WAXscope. That's where I feel the WAXscope really differs from your traditional head loops. When I used to use head loops, and they were good quality ones, the magnification just wasn't there. And also, it's very difficult to see deep in the ear with precision and clarity. So if you're removing wax from the outer third of the ear canal, or even the outer half, loops, I felt okay using them, but a lot of people with earwax come with impacted earwax, so it's beyond that second bed, it's deeper in the ear, and I just didn't feel comfortable using the loops. And in a way, that's what's inspired the development of the iClearScope and subsequently the WAXscope. So it gave me that perspective of the limitations in terms of ear care that loops, in my opinion at least, provide. So you can just see how clear this image is as well with the WAXscope. It's slightly different to the endoscope. With an endoscope, you don't really have to adjust the focus because the tip of the endoscope is inside the ear. Hence the name endoscope, is inside the body opening and cavity. With the WAXscope, it's more like an ENT microscope. You can call it another name, potentially can give it, it's called an exoscope. exo, so the camera is actually outside of the ear, which then means the focus is a bit more, you have to adjust the focus unless you're going forward and backwards with the specky in the ear. As I said, I prefer just getting the specky in position, so it's in place, everything's secure, and then you adjust the focus. And that's the same with the microscope. The microscope, you have to go forwards and backwards with the microscope, with your head loops, forwards and backwards with your head. With this, you don't really have to do that. So I think ergonomically, this provides a lot more benefits than using head loops and a microscope, because you're in a fixed position and you just change the focus with your finger. So you don't have to go forwards and backwards. Also when patients slightly move as well, with, when I'm using a looped microscope, you're having to then readjust yourself to regain focus and position. And also with the head loops microscope, when you're visualizing different parts of the ear, you're having to reposition your head or the patient's head. With this, you're just moving your wrist to move the position of the speculum within the ear. So again, I just used the zoom feature there to remove some wax that was close to the anterior canal wall near the eardrum. Got a good visualization of the eardrum here. There's no temporal sclerosis, no scar tissue, there's no opaqueness like there was in the left ear. So you can see the blood vessels there, just zooming in, getting in focus. We're going to see some still images in a moment. That's the wax from both ears, and the large plug there, you're going to see a zoomed in image of that in a moment. That's from the patient's left ear, when I extracted it using a sizable chunk. To see how dark it is, it's oxidized, it's been there for a while. Well, I hope you enjoyed that video.